On this episode, we'll talk about dumping syndrome, being cold after surgery, and having to lose weight before your surgery. Welcome to episode 12. Very excited to be here. We're just finishing off the IFSO Conference here in Vienna. Austria has treated us so well. We were able to share some of our experiences regarding the gastric sleeve. We learned some too from surgeons from all over the world. Great experience, and well, let's get into the show.
What is dumping syndrome?
Let's talk a little about dumping syndrome. Dumping syndrome is something very commonly seen in gastric bypass patients, but it's not that common with the gastric sleeve patients. You're talking about a very minority of the patients that may have what we call a dumping syndrome. 5 to 7% of the patients may have some dumping syndrome that have a gastric sleeve. Now, what is this syndrome? It's a syndrome, when we talk about syndrome, it's a combination of symptoms a patient may have. Symptoms like tachycardia, rapid heart rate, palpitations, sweatiness, dizziness, even some nausea or even vomiting after eating a very dense food. Talking about dense food, we're mentioning about very high concentrated sugars, shakes, or very high osmolarity foods that may enter your GI tract. What happens is very high concentrations of food go into your sleeve and rapidly enter the first portion of your intestine and will trigger this syndrome. Why didn't you have it before surgery? The reason is very simple, because you did have a big pouch of stomach, a regular stomach, that was able to hold food for longer periods of time, digest food, and then once it's digested and diluted with some saliva, then passed into your intestine. Not anymore. Now you have a very small sleeve, very small stomach that will actually hold it for a while and then pass it along to your intestine and trigger the syndrome. Don't get overwhelmed with this. Remember, the very minority of the patients will develop this syndrome, easily treated by avoiding very copious foods, very large amounts, or very high concentrated with sweets or sugars.
Is it normal to be cold a lot since weight loss surgery?
All right, being cold after surgery is very simple. Absolutely everybody has a thin layer of fat tissue underneath your skin. That layer of fat tissue may be big or small or in between, but everybody has it, no matter how thin you are. Now, that fat tissue, that fat pad, actually serves as a barrier toward the outer temperature. Once you start losing weight, that fat tissue starts to get thinner and thinner and thinner. You still have it, but in a thinner layer. So actually, instead of having a very big jacket, now you have a very thin layered jacket, in other words, and that will give you the cold sensation because your body was adjusted to a certain set point. Now that fat tissue is gone, and your body will perceive the outer temperature in a very easy way.
I need to lose 50 pounds before surgery. I already changed my eating habits. Have you gained weight? What should I do now?
All right, let's talk about the pre-op diet and why you have to lose some weight before surgery. It's not because I want to give you a hard time or your surgeon wants to give you a hard time. It's because of something, all right? It's because we know about this. It's because we want to give you the best outcome possible. If you don't lose weight, if we don't put you on a liquid diet, if you don't follow the instructions, you will not lose what we call the visceral fat. Visceral fat is fat around the organs, but most importantly, your liver size which is extremely important at the time of surgery. If you don't lose the weight, you will not shrink your liver, and surgery in some cases, if you're not compliant with your surgeon's diet, sometimes it's not even possible. So you need to be very compliant with this, follow your surgeon's rules and what he or she needs you to lose before the surgery. So that's it for episode number 12, coming direct from you from the IFSO Conference, World Congress on Weight Loss Surgery from Vienna, from Austria. We had a really great time. I'll leave you here with a view of Vienna, really nice scenery, spectacular town to walk and discover. You'll love it, and here are some videos, and we'll see you on episode 13.